We've heard doctors and patients alike talk a lot about lung cancer today on this fourth annual LCFA World Lung Cancer Day social media takeover. But did you know there are different kinds of lung cancer?
There really are. There are many types. And the positive takeaway is that if you understand which type of lung cancer you're facing, it can really help with you getting a more targeted therapy.
Our friend Dr. O recently sat down with LCFA Speakers Bureau member Brandi Bryant to talk about the differences between small cell lung cancer and non-small cell lung cancer, and to share some important information about lung cancer in the Black community.
What is the difference between small cell lung cancer and non-small cell lung cancer?
Yes, thank you, Brandi. Small cell lung cancer is a more aggressive form of lung cancer than the other group, non-small cell lung cancer. Fortunately, it's only 15% of all lung cancers in the United States, but it tends to be more aggressive. Its treatment is quite different. So, for example, patients who have non-small cell lung cancer, in most cases, the first question we have for them is, can we have surgery? In most cases, for small cell lung cancer, surgery is usually not an option. But we are excited, though, that in recent times, we're beginning to find small cell lung cancer earlier and earlier, and sometimes we're actually able to offer patients surgery. The other big difference, though, is that small cell lung cancer always requires chemotherapy or some kind of systemic therapy for it. Non-small cell lung cancer, if caught early enough, we can have surgery or some type of radiation without necessarily needing chemotherapy.
Okay, all right. So you were talking about the different types of treatment for small cell lung cancer. What are the latest types of treatment for it? What are the advances in research for small cell lung cancer?
So I mentioned the idea that sometimes we can catch small cell lung cancer when it's still a tiny spot and we get surprised. We think, oh, this is going to be non-small cell lung cancer. The patient has surgery and it turns out, lo and behold, it's small cell lung cancer. Those patients, we now recognize surgery actually can help cure the cancer. Usually we would always add chemotherapy for their treatment. But what's more exciting is that more and more, a larger group of these patients with more advanced disease, we know we can add immunotherapy to their treatment, drugs to stimulate the immune system to fight the cancer. We already know that for a fact for people with stage 4 small cell lung cancer, and we're excited that we just finished a clinical trial, LUN-005, asking the question, when you give chemotherapy and immunotherapy to patients with potentially curable small cell lung cancer, will adding immunotherapy increase cure rates? We're going to see what that trial shows in a few years.
That is very exciting. That is an answer that gives a lot of hope. So my final question is for members of the Black community. How can they be sure that they are getting the latest treatment, the best treatment available, and make sure that they have access to advances in treatment that are available for small cell lung cancer?
Yes, Brandi. Lung cancer is very important in the Black community because lung cancer actually affects more Black people in America than other races. And traditionally, our outcomes have been a little bit worse than other races for many different reasons. A big part of it is that people don't present, even when their symptoms begin, on time to get the help that they need. Sometimes there is this skepticism that people have, so the recommendations for treatment, sometimes people seem reluctant to engage. Traditionally, our community has not been as active in participating in clinical trials as we need them to be. And that too is a big part of it. There are many reasons why people are hesitant, but I think we have to remind everybody now that we're now in an age of rapid discovery. Things are getting better, and we want to encourage Black folks to participate in everything that's available to them.
Excellent insight from Dr. O. To learn more about the different types of lung cancer, go to Lung Cancer Foundation of America's website because it's just an excellent resource.
It sure is. You can learn more about the latest lung cancer research, much of it funded by LCFA, in fact, and about caregiving and helpful videos about living with lung cancer.
Again, you'll find all of that information at lcfamerica.org. And today, don't forget to like, share, and follow LCFA on all social media platforms.